The honourable member for Courtenay-Alberni.
Thank you, Madam Speaker. Madam Speaker, I'm here tonight on behalf of the 40,000 Canadian families that have lost loved ones since 2016, since this government formed power due to the toxic drug supply. Madam Speaker, and as well for those that are living with problematic substance use, recreational users of substance use that are dying from preventable deaths. Madam Speaker, just to give you some context, right now in Canada, about 180 Canadians die per million due to toxic drugs. In British Columbia, it's 430 in my home province. In my island health region, it's over 500, and in the Alberni Valley where I live, it's over 1,000. But get this number, Madam Speaker, for under the age of 49, it is right now over 2,100 people per million, Madam Speaker, that are dying from toxic drugs. It's off the chart. And I've been asking, and New Democrats have been asking, for the federal government to come up with a plan, a timeline and resources to respond to this health emergency. In fact, Madam Speaker, they not only have failed to do that, they haven't even spent 1% of what they spent in the response to the COVID-19 pandemic, Madam Speaker. And why? Because of the stigma. That is the only reason, Madam Speaker, that they haven't responded, because there is solutions out there. And Madam Speaker, I took it upon myself to go to Portugal this last summer on my own dime to learn from Portugal. Why, Madam Speaker? Because they had 6 deaths per million. And like when I painted the picture of how many people are dying in Canada, just to put things in perspective, more people have died in Canada from a toxic drug supply than all of the European Union, over 450 million people. Now, the Portuguese story is quite interesting, Madam Speaker, because they had a massive drug crisis that was claiming the lives of many people in the mid-90s. Over 1,000 people were dying, primarily through heroin users. They had 100,000 heroin users at a population of 10 million. Now, just to put things in perspective, in British Columbia, in my home province, we have 100,000 chronic substance users in a population of 5 million. So they had we have double what they had in terms of per capita usage of chronic substance users, Madam Speaker. But they realized it was a health emergency, and they responded like it was a health emergency, Madam Speaker. They convened a table of experts. They decided to move forward with expert-based policy. They created treatment on demand, a safer supply of substances. They scaled up, Madam Speaker. Just get this. They had 250 people on methadone at the start of their program, and they scaled that up to 35,000 in 2 years. They used the military to create labs to lower the cost and get supply out the door. And Madam Speaker, today they have 20,000 chronic substance users. They created, they focused on harm reduction, making sure that people got the support they did, Madam Speaker. And I'll tell you about the politicians and what they did and how they were the heroes here, is they took the gloves off, stepped out of the way, and stopped playing politics and got rid of their ideology. And Portugal focused on evidence-based decision-making led by experts, and they put forward a plan with resources, a timeline, and a strategy. Unbelievable, Madam Speaker. We actually had an expert task force on substance use from Health Canada, but what does the federal government do? They chose to ignore them. Still no plan, no timeline, no resources. When is this government going to treat this as a true public health emergency? Where is the urgency?
The Honourable Parliamentary Secretary to the Minister of Mental Health and Addictions and Associate Minister of Health.
Thank you very much, Madam Speaker, and I want to thank the member for the question. I want to thank the member for his passion on this topic, and I've spoken to him several times already since I've gotten this role, and I can only learn from this member and continue to appreciate his passion and his knowledge on this topic. Madam Speaker, this toxic drug and overdose crisis is having a tragic and unrelenting toll on Canadians, their families, their communities, and this member knows this. There are 4 pillars recognized internationally that are necessary for a successful substance use strategy: prevention, harm reduction, treatment, and enforcement. We are committed to a comprehensive approach that implements policies and supports in all 4 of these essential areas, and the member opposite is a key ally in solving this crisis. Every person who overdoses is somebody who has a family, somebody that has people who care about them. Madam Speaker, I believe that these deaths are, as the member said, preventable. Many of these individuals perhaps have hid their drug use. They feel unable or afraid to seek help. Many died alone. We must take urgent action to save lives and protect the health and safety of Canadians. We've committed more than $1 billion for a full range of evidence-based actions focused on prevention, harm reduction, treatment, and enforcement. Sadly, this crisis is evolving and worsening. The drugs are getting more toxic. Substance use intersects with other issues like poverty, homelessness, and mental health. So we do need to evolve our understanding of the crisis, and we do need to continue to improve the government's work to save lives and protect the health and safety of Canadians. Substance use is a health issue, and healthcare is a shared responsibility across all orders of government. Most importantly, and because I know some members in this House still disagree with this, harm reduction is healthcare. This is why we continue to support provinces, support territories, Indigenous communities to improve access to integrated, evidence-based substance use services and supports for all Canadians when and where they need it. Madam Speaker, creating false narratives is not useful to anyone, and I'm happy that the member from Courtenay-Alberni agrees with us on this and is helping us fight misinformation. We are providing nearly $200 billion to the provinces and territories over the next 10 years to support health system reform across Canada, and $25 billion of that money is for shared health priorities such as improving access to mental health and substance use services. Now, these historic investments will seek to integrate mental health and substance use care across the entire health system, meaning that no matter where, when, or how someone reaches out for help, there will be no wrong door. And Madam Speaker, I'm optimistic that we can get there. There's no one-size-fits-all solution to address this complex crisis. Each person's circumstance is unique, and solutions to the crisis must recognize that people use substances for different reasons and in different ways. Madam Speaker, offering treatment alone is not enough. Providing a broad array of care options and wraparound supports allows people to access the right services at the right time to improve their overall health and well-being. We can't end this crisis alone, Madam Speaker. It is our collective responsibility to work together as parliamentarians with the member from Courtenay-Alberni, with local communities, provinces and territories, and as well as Indigenous communities. We can't be working in silos through an approach that isn't integrated. Thank you, Madam